Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned anesthesiologist, Dr. Parimala Prasanna Simha. She is a professor of anesthesiology in Jaideva Institute of Cardiology. So she is called as the cardiac anesthesiologist because especially for the cardiac patient, she is expert in giving that. And today she is here to explain to us what is anesthesia, what are the types of anesthesia, and when and how they are used. Welcome, Dr. Parimala.
Thank you, madam. Thank you so much for inviting me.
It's a pleasure to have you because you have always been so kind to my children, my patients, and used to give so beautiful anesthesia that I could do all the interventions without any worry or without any struggle. And in fact, people say, the surgeon and the anesthesia, they don't get along. But, we used to get along so well like hand and glove. So I'm very happy that you are here on my show.
Thank you
Please
so
tell us
much.
why, yeah, please tell us why this October 16th is called as the World Anesthesia Day.
This is the day in 1846, Dr. William Martin, for the first time, gave a proper anesthesia to a patient, and the surgeon was a surgeon as well as all the people who had gathered to see the operation were surprised that patient did not move, and uh, the modern anesthesia started from that day. So today it is celebrated as World Anesthesia Day.
Wow, that's so nice. Because earlier, but in the time of Sushruta, they had their own way. And I have heard that even in Indian Ayurvedic, they had some medicine by which they used to give anesthesia. Maybe that was lost over the period. Now, what are the types of anesthesia, like local, spinal, whatever words you have? Please explain to the people.
Thank you, ma'am. There are mainly we call general anesthesia where the patient is made unconscious, so he will not remember the whole surgical experience. Whereas some operations can be done without making the patient totally unconscious by giving injections to the nerves which supply that particular part of the body, like spinal anesthesia or epidural anesthesia or regional blocks we give, so that patient can go home early, and also they will recover faster. They'll not have any prolonged sedation because of general anesthesia.
Hmm. Yeah, that's really nice. Some women, they are very bothered about the pain, labor pain during the delivery. They also ask for the anesthesia, and if they become unconscious, they cannot deliver. So, what is the anesthesia given there?
Yes, labor analgesia is usually given by epidural analgesia. So we
Hmm.
give a small dose so that patient is able to move around, and when required, we can give a higher dose if patient requires cesarean. From the same, we put a catheter there in the epidural space, so it
Hmm.
can be converted to deeper plane of anesthesia where a patient will not move also, because surgeon when they have to operate, they do not want muscles to contract, they want a relaxed patient. So this epidural analgesia has changed the way modern delivery is done. They don't
Hmm.
have to go through that experience anymore.
Yeah, yeah. The labor pain is one of the worst pain, and the next to that is the pain, toothache. So, and next is the headache. So, but for headache, nobody gives the anesthesia. But for the toothache and to extract the tooth and for delivery, they give definitely anesthesia. And being a cardiac anesthesiologist, please tell me what sort of anesthesia do you give for the open heart surgeries?
Yes, madam. Mostly it is general anesthesia,
Yeah.
wherein we can do a long, prolonged operation without making patient
Hmm.
suffer in any way. So we
Hmm.
give injections as well as drugs to the endotracheal tube, which is put in the trachea, so that the patient will not have any uh, airway problems, because when we
Obstruction.
do operations
Mm.
in the heart and lungs, we have to control ventilation. And when we go on cardiopulmonary bypass, during that time, in fact, we give injections as well as
Mm.
inhalation drugs into the cardiopulmonary bypass machine. Through
Mm.
that, the patient will be kept
Mm.
unconscious for the
Mm.
period of surgery. And modern day drugs are so fast acting, they can, as soon as we stop the injections, they will be made awake also,
Yeah,
so
it's
that
a short
they
acting, short acting.
yes,
Okay.
yes. So all new drugs are shorter acting, and also they don't have a major effect on the
Side
other
effects.
organs.
Yeah, yeah.
So they
When
recover
you
fast.
yeah, when you spoke about the shorter action and uh, side effect, I remember 50 years back, when we were medical students, our ENT surgeon professor, he operated on a boy, the NRI boy, for the deviated nasal septum under local. He developed a severe thing, and then he literally we lost that person. So the whole medical college was shocked. And after that, when I became a house surgeon, one of our colleagues, the doctor's mother, she came for the hysterectomy. The moment the general anesthesia was given, even before incision was put, she died. So those were the days when people were very scared of anesthesia. So today, how do you compare the past anesthesia to the present day maintenance of anesthesia?
It has become, for me, only over 30 years. I have started with ether anesthesia, as in
Mm.
Dr. Martin's time. Ether
Mm.
anesthesia through a mask and a gauze piece. We used to drop ether on the mask with the
Mm.
gauze piece covered. That was the day when we were also very scared. In fact, I was scared to take up the branch of anesthesia. But then
Okay. Okay.
gradually, as we progressed, now we got halothane, but then they had some liver toxicity. Now
Mm.
we have sevoflurane,
Mm.
isoflurane, which are safer,
Mm.
and patient recovery is also faster. We
Mm.
study in detail about each
Mm.
drug before it is released into the market, so
Mm.
that injections as well as the inhalational drugs are very safe.
Mm.
And in fact, now they even give patient controlled analgesia in the ICUs, where
Mm.
patient, if he has pain, he can only direct the computer to give so much drug, so that he maintains, and he is very safe. Everybody
Mm.
feels safe to give anesthesia these days.
Yeah, yeah, yeah. And not only that, the equipments and everything is so refined compared to what it was. Then with just open mask, then ambu bag, you used to go on giving oxygen. But now you automatically connect, and then ventilator will take care of that. And it is so very easy. And with the innovation, the open heart surgery for the heart, and that also has refined. Now people are opting for the beating heart surgery, thinking that it is much better because giving cardioplegic solution and making the heart to go into arrest. My own classmate, she came for the open heart surgery, and when cardioplegic solution was done, operation was done, and she never came back. I still remember my own classmate we lost after the bypass surgery. But now the beating heart surgery has come. So how do you maintain in the beating heart surgery?
These are special techniques. First of all, when beating heart surgery, especially if it is done not from the midline, by the side of the patient's body, they'll not have a open scar. And for that, we give a local injection there. And
Mm.
then when a surgeon has to do the operation through the side of the body, he
Thoracotomy.
has to retract the lung.
Okay.
So that time we give what is called one lung anesthesia. One lung we
Oh,
can lock for some time, so that there
okay.
is enough space for. So these are all technically challenging, but
Yes.
we have to progress with the need of the
Our.
modern surgery. So we
Yeah.
have devised these things so that
Mm.
immediately patient as well as surgeon is comfortable for the surgery, and
Mm.
also recovery is fast. Again, when we don't go on cardiopulmonary bypass, they recover fast.
Yeah, and that too, complications of brain injury and the maintenance of circulation, all that is not there. And apart from that, the patient can be singing or listening to the music and undergoing the surgery. And the surgeon also can sing and do the surgery. It is like a beautiful thing. Nobody realizes that it's a major surgery, like in the olden days when they always had the fear, the going for anesthesia and coming to wait, and now it is much better. So what do you say about it?
Yes, madam, I agree with you. And it has improved our, as you say, the surgeon and anesthetist, they have to work together, and
Yes.
everyone is comfortable and they
Yeah.
are able to listen to the music. And
Yeah.
in future, even patient is able to hear. Then
Yes.
in neurosurgery, sometimes they do what is called awake surgery. For that
Oh.
also local injections are given, because the surgeon, when
Hmm.
he's operating on a very delicate area, he wants
Hmm.
to avoid injury to the nerves which supply that
Yes.
part.
Yes.
So if he's a musician, or if the patient wants to use his hands,
Hmm.
because that is his profession, then they will very carefully
Like
operate.
playing sitar or harmonium or the
Yes.
veena, so that they have to be very careful. Yeah.
So those things are also in news, that surgery was performed like this without
Okay.
making the patient unconscious.
Unconscious. Yeah. Yeah. My classmate's husband, he came for the fitness for surgery, and on Saturday I had given the fitness, and Monday he went for surgery. And the moment he was induced, they could not put the endotracheal tube, and he died. So such these are anecdotal, but lakhs and lakhs of people all over the world, they are benefited by anesthesia. And very rarely such catastrophic things can happen, and then one has to be very careful. And I'm sure with the present day modern techniques and the available drugs, the complications are much
Yes.
less, I
Now
suppose.
we have video laryngoscope also, what we call fiber optic bronchoscopes. So new
Okay.
anesthetists are trained to use these, so
Hmm.
that it is no more a situation where they're not able to ventilate or breathe properly. So
Goes into spasm, and then you can't put the tube at all inside, and that used to happen in the past.
So today these are all very rare, because
Very rare.
every operation theater is equipped with all these modern
Hmm.
facilities, so that a safe anesthesia can be given.
Hmm. So thank you so much. You have explained
Mhm.
so many things. And even the smallest baby, 2 kilos or 1.8 kilos, used to give epidural anesthesia and make my life so easy, for me to do the interventions. And I think, the anesthesiologists and the interventionists or the surgeons, we have to work
Yes,
like a team. And
yes,
unless we work like a hand and glove, the success will not be there. And I think ultimately I would say that anesthesiologists are the silent warriors, because the patient will see the surgeon but not the anesthesiologist, not many times. Maybe in the recovery time they see you, otherwise the contact is not there. So thank you very much for explaining so beautifully and so nicely,
thank you.
and you have made everyone feel happy and very safe, to go undergo the anesthesia.
Thank you,
Thank you
ma'am.
very much, Dr. Parimala.
Thank you
Thank
so
you.
much, ma'am.
Okay.